Hello, my friends. I am Dr. Camacho, an ear, nose, and throat surgeon. In this video, I'm going to talk to you about the sinuses of the face. Here you see a lady, the blue structures in her face. These are the paranasal sinuses. You have some in the forehead, between the eyes, in the middle of the head, and in the cheeks. Here you see it better. In red, I'm demonstrating the frontal sinus. It's in the forehead. There's bone surrounding it. And you can think of it kind of like a bumper in a car. If it gets smashed in from an injury or trauma, this will help to act as a buffer. In yellow, I'm showing what are called the ethmoid sinuses. These sinuses are between the eyes, and sometimes if someone gets a really bad infection, they can feel the pressure between the eyes or near the eyes. In green, I am showing what are called the maxillary sinuses. These are in the cheek, and these sinuses can cause pressure and pain in the teeth, especially when they're infected. And from the side view, you can see in blue, this is the sphenoid sinus. In red, I'm showing the frontal sinus of the forehead. In yellow, this is the ethmoid sinus. And in green is a maxillary sinus. Here it is shown again in red. As we zoom in, you can kind of see the structures. From the side view, in this woman, what I'm demonstrating is sinusitis, and that's when instead of being filled with air, you have tissue from the sinuses that get thickened. It's called mucosa. And once they become polyps, you can see between her eyes, it's very inflamed. That tissue can cause pressure, difficulty with smelling things. This is the maxillary or cheek sinus, the ethmoid sinus between the eyes, and the frontal sinus in the forehead. The septum is a structure in the middle of the nose. It divides the right side and the left side from each other. Here you have the three turbinates. There's a superior turbinate, which is the one that's up near the top of the skull in the inside of the nose. You have the middle turbinates, which are the ones that are located in the middle of the nose on the inside. And then you have the inferior turbinates. The inferior turbinates are highly associated with the sense of congestion and airflow. If these are very swollen, such as when patients have allergies, you might find that it's difficult to take a good breath through your nose. And children who have large turbinates and adults who have large turbinates often will have sneezing, itchy nose, the salute sign where they rub their nose and they get a little mark on top. And in general, they tend to have allergies. Here I'm showing a CT scan, and bone shows up in white. This part right here of the septum is bony. There's also cartilaginous septum in the front, but this is a deeper image or illustration. So the bone portion of the septum is shown here in the middle. Then you have the superior, the middle, and the inferior turbinates. These are shown with the white on the inside because they have bone. Around the white is the mucosa or tissue that can get swollen. You also can see the ethmoid sinuses. It looks like a honeycomb here between the eyes. And then under the eyes, you'll see the maxillary sinus. And interestingly, the teeth shown here, they'll actually come up in some people, and you'll have the roots that are not quite all the way in the sinus, but very near to the sinus. Sometimes, especially third molars may pop into the sinus. And when oral surgeons remove third molars, sometimes part of the tooth will get into the maxillary sinus. In the forehead, we have the frontal sinus, which you can't see here. This is a good side-by-side with what you would see in a patient who has air shown in blue. And then on the patient's left side, which is the right side of the screen, in here, you can see a space, and this is after a sinus surgery. The openings of the forehead, frontal sinus, and here the maxillary sinus were made bigger. Sometimes we'll often take out the ethmoid sinuses if there is chronic sinusitis or recurring infections. When we do sinus surgery, however, you can see this part, the middle part that's close to the eye, is the lateral or side part of the ethmoid sinus. So we have to be very careful when we do surgery here. Here you see the skull base, and the skull base is the bottom part of the skull on the inside, which is also the roof of the nasal cavity. When we do sinus surgery or a septoplasty, it is possible to cause a little leak here in this area called the cerebrospinal fluid or CSF leak, and that's where brain fluid can leak out. That is very rare, but if it happens, patients usually can have some bed rest and that'll slow it down. Sometimes we may have to go in and actually fix the opening by putting a patch in the area. Here we see a lady with a deviated septum. I'm showing it now in red. The inside of her nose is twisted to the left, her left, and it kind of looks like this. The tissue actually on the inside looks pink, but I drew it this way to demonstrate. And in these patients, they're often more susceptible to sinus problems, congestion, eustachian tube problems, and that's because when the septum deviates, the airflow on that side especially is very restricted, and the little air that does go through goes in very quickly, and that can cause a lot of problems. Bloody noses, eustachian tube problems, nasal congestion. In this case, I'm showing polyps, and they're almost like grapes. Think of grapes that have been peeled. When you look at a polyp, it's kind of like that. It has a yellow-white appearance to the surface. And when you grab them, oftentimes they just tear, like if you can imagine grabbing a grape. So when we do sinus surgery for nasal polyps, we often will open the cheek sinuses, pull out any polyps, remove the polyps between the eyes and the ethmoid sinuses, and also in the frontal sinus. Additionally, in the center of the head, the sphenoid sinus, if there are polyps there, we also remove them. And in the process, we make the openings bigger. It is key that after the surgery, the patient be on medications for allergies, and also to do sinus rinses, nasal steroids in the rinses, often budesonide rinses, and that'll help to prevent future polyps or the regrowth of polyps. A problem is that patients often feel better after sinus surgery, and they may stop doing all their medications. And I had a patient who had full sinus surgery. It took me 4 hours, and a month later, they came back. So it is disappointing when they come back. Sometimes patients need multiple surgeries. And that's it. I wanted to share what the anatomy of the paranasal sinuses are. Thank you for watching. I appreciate it. Have a great day.